before I get started, I want to thank the creator for allowing me to be able to make it on the 405 this morning. It was tight this morning. I also want to thank my parents, who were both school teachers, and especially my mother, who ensured that I became a school psychologist. I was a psych major, and I really wanted to go into clinical psych, but she said, as much trouble as you had in school, you're going to be able to help a lot of people. So always think of my mother. Also really want to dedicate this work in particular to Valerie Cook Morales, who gave me a chance when I had a really low GRE score. I wasn't really enthused about going to graduate school. I was planning on, and nothing wrong with being a PE teacher, but that's what I was planning on doing, living by the beach, surfing all day. But she said, you know, I think you could probably do some good things if you came to San Diego State. And she's recently passed, but she's always with me, especially as I get down to typing and planning about different things that we can do to help students. I really want to help the, or at least think about the help that I've received from families and students, especially when I first started. I don't know about you, but when I was an intern, I really felt compelled to either just be so grateful and sometimes apologize to all these folks who really taught me when I thought I was going around trying to teach them a few things. I even had the nerve to teach a parenting class when I was an intern. And I learned a lot more than I was giving out. And I definitely want to thank my graduate students who went out and did a lot of this research and helped put a lot of these ideas together. So there are two handouts here. I have one that's mainly the PowerPoint handout, then another that's a small package. It's about 4 pages with different things that I'll go over, but it has to do with the mental health piece and the data collection piece more specifically. So let's go ahead and get into it. Right, again, feel free to ask any questions along the way. There we go. All right. Let's see if I can. Okay, NASP and mental health. So the model for practice here that's been updated since 2010 has a very particular emphasis on mental health. And if you've been following the conversation regarding AB 3632, AB 114, the changes in county mental health funding, you've probably listened to, especially our colleagues who are practitioners, said, I don't know if I even have the time to do these types of things. However, if we're looking at the standards for practice, especially those of us who are trainers, the standards for practice is clear in regards to school psychologists in collaboration with others, demonstrate skills to use assessment and data collection methods to implement and evaluate services that support socialization, learning, and mental health. We are examples of professional practices associated with development of social, emotional, behavioral, and life skills. This is coming right out of the NASP best practices, so that's really guiding the direction where I wanted to go today. Moving on to, there's 2 different parts here that we'll share today, and so after part 1, we'll take a break. One of my graduate students asked me, are we going to take a break? Because she knows I can just go on and talk about school psychology. And so part 1, we'll be taking a break, and we'll also have part 2. But part 1, we'll share the results of surveys from school-based mental health providers. And I was really interested in school-based mental health providers and what their experience has been in promoting access for all students, but in particular for minority students. And so I had my graduate students ask some things about that. So we'll share some historical literature in the context. We'll also have a view of minority access for mental health. We'll take a look at school-based mental health providers' report of mental health services delivered. Also, who refers to school-based mental health providers for services, and who school-based mental health providers indicated received their services, and what they really need to do the job, at least from the school-based mental health providers' perspective. And finally, who are school-based mental health providers who have access, and who do they access for their social capital networks. And I'll explain a little bit more about social capital networks as we get to that point. Part 2, we're going to share some tools for data collection and recommendations. And so we'll look at the NASP model for exemplary mental health programs. the types of data collections for trends in mental health, whether it's counseling, SSTs, or triennials. And I really wanted to focus in on those particular types of data sets because these are likely the data sets that school psychologists already collect, but there's ways that we can maximize our use of that information to better target particular student populations or improve our own services. Also, we'll talk about examples of different trends in mental health services, and we'll provide some recommendations around planning, community involvement, family, and stigma reduction. So let's get into the study results here, but we'll start with the historical context. So in America, and what I like to remind folk, and my mother consistently reminds me of this, my mother-in-law as well, they both went to segregated high schools. So segregation was legal in America. My mother-in-law and my mother just retired very recently, within the last 3 years, from teaching in public school systems. So the people who have taught in public school systems have a memory or even a direct connection to this time where segregation was legal within America. Just to add an extra point, we're here in Costa Mesa, and I mentioned before I enjoy surfing down this way. And I saw this movie recently called Whitewash. It was about the story of black surfers all over the world, but in particular in California, and how some of the reasons why, because there's myths been created that black people don't swim, black people don't surf. These myths, which have been going on because really there's actual artifacts and data and tribes of folks in Africa who do surf. How did these myths get created? It was really through the legacy of segregation, where people could not go to segregated pools. So you have whole generations, only within the last maybe 100 years, who could not go to segregated pools. And my father, he was kind of an anomaly because he grew up near Lake Michigan. So he learned how to swim, so I just thought, well, everybody just swims. I had no idea. But even here in California, in Santa Monica, there's a beach called the Inkwell Beach, which is a kind of an acronym or a term that people would use to talk about segregated beaches. And they just recently put up a plaque, I think about 2009 or so, they put up a plaque just to commemorate the fact that this occurred. So if you have these types of racialized contexts in regards to particular types of services, you can extend that from the public pools to the public schools. You have these contexts of racialized segregation for schools itself. And you have right here in Orange County, Mendez versus Westminster. I don't know if anyone was here last year, had a chance to hear Sylvia Mendez speak about her experiences. I had a chance to sit next with her at breakfast, and she shared just some good experiences about her own ability to share with others her life story, but also some of the trauma and pain that went with it. So I'm going somewhere with this piece in regards to folks grow up with this idea that there's certain places I'm not supposed to go. Other places may be the actual school setting, to deal or interact with the school psychologist. Why would I do that? Because my kid's not going to gifted and talented education. Or the last time my kid went inside some building with a locked door, I don't know what was going to happen to them. Or there was all this chaos and animosity over these particular issues. So with the Mendez versus Westminster case, you have real young little children integrating a local school, where even their father had gone before, but because there was segregation laws passed, they weren't able to go. So there's some stigma still left, rightly so, based on historical context. The other piece has been the economic challenges, and usually those with the least have their support services cut first. Okay. If you consider staffing ratios for larger school districts or the types of demands that go on, sometimes folks don't have that access to those mental health services. So, and again, that belief in the education model that did not include student support services. I'll give you another example just to provide some of the context. When I was an intern, And some of y'all may remember this program. It was the primary intervention program. Pete Wilson put together some money for the children who were right in between. And this paid my internship salary. Meager as it was, I was still able to get some gas and have a humble abode. And my wife was somewhat impressed with that at the time. But there was great gains shown in student progress. However, the program was only funded from the state, and the district decided not to renew it because they wanted to have more emphasis on the reading, writing, and math rather than on the support services. And usually in tight times, there's a contraction of those support services. Or there's an emphasis that if we do have support services, y'all don't need to be focused on mental health. You need to be focused in on reading, writing, and math, because we can't quite see that connection. And at least that's the type of conversations that were coming from the school board at the time when I was an intern. So there's policies and different developments that have affected mental health services, compulsory education, and sometimes even the attitude of compulsory education, where we know it's wrong, we know it's ethically wrong. However, sometimes folks will say, if you want to stay at this school, kid, you need to go and see the school psychologist or go get some anger management counseling. That's a very different setup than our colleagues who are in marriage and family therapy or work in a clinical setting. So the first interaction the kid has is, you have to go see a school psychologist. Not for your life to get better, not for things to help you out, but because we've told you, and it's compulsory. The Community Mental Health Centers Act in 1963 did help with some of those things. NASP founded in 1969, IDEA in 1975. So, and some of these efforts help bring clinical psychologists as well, or other types of consultants into the school setting to provide mental health support. I think also, after World War II, everybody during World War II was testing backwards and forwards, and they developed a lot of their different test materials. But by 1975, we're all familiar with the refer, test, place model. I don't know about y'all, when I took my first intro to school psych class, that was the conversation, that school psychology had been kind of locked into this refer, test, place model because of the access to funding. And feel free to ask questions at any time if I say something that's a little unusual. So I wanted to define a few terms because there was a period where, and if you're familiar with San Diego State, I'll just be real, they kind of interrogate you about your views and biases of either minority issues or cultural competence, and they really want you to define these terms before you go around using them. I remember, I think my first 5 years, I didn't even say at risk, because I had this vision of Dr. Cook Morales' just coming after me and saying, you're not going to say that to these folks here. You're not going to call kids at risk without defining the term. So I didn't want to just put that term out there, minority group, without really taking some time to define it. So this is one that I found, and it's really coming from Miranda and the best practices on cultural competence. But a group of people who, because of physical and cultural characteristics, are singled out from others in society in which they live for differential and unequal treatment, and who therefore regards themselves as objects of collective discrimination. Now, I think that last piece really, as far as objects of either collective discrimination, either real or perceived, but this idea that we're not having access, I think, connects quite well to this definition of minorities and this piece of access. Now, discrimination in my mother's age, very different than the type of discrimination that anyone may experience nowadays in the United States, at least. However, if we look at the numbers, we may find that we are missing a particular group. Now, I'm putting more of a generic term on discrimination, in that we may have missed a population. Now, let's say, for example, if we don't collect the data sets by particular ethnic groups or by gender, just even a basic one. That's only two groups. If we don't collect those, or even by grade level, we may miss a certain population. However, and I'll share a little bit more with the study, what I found is that folks aren't collecting as much data as they could in regards to this particular issue. So things like overrepresentation of minority and special ed continue. It wasn't until No Child Left Behind, for right or wrong, that the accountability, at least at the federal level, began. There were some cases where the State Commission on Civil Rights may come and investigate and require that folk do that, but by and large, it's been a slow progression to get to that point where it's even a requirement. However, it's not necessarily a requirement for school psychologists to keep track, or school-based mental health providers to keep track of the type of services that they deliver, who has access to those services. Let's take a look at some other definitions. So ethnicity, a social construct that divides people into smaller groups based on a shared sense of group. And ethnicity is different from race, but both are social constructs that artificially divides people into a distinct group based on immutable traits, everything from skin color to country of origin. Also, the political needs of society, and I'll give one example of that. The term Hispanic didn't come into being until the 1970s under the Nixon administration. And it was used to kind of coalesce linguistics. However, if you talk to most folks here in California, may not quite go with that term right away, because it's still a political definition used simply for demographic collection, but it doesn't necessarily speak to the ethnicity of the people. I talked to some students the other day, and these are some of my undergraduate students at Cal State Long Beach at a multicultural fair, and there was a young woman there who was letting people know that I'm Guatemalan. My life is very different than Chicanos here from Southern California, from Mexicans and nearby where I grew up or lived, very different from Puerto Ricans, but it's interesting how folk like to just lump us all together. Imagine if I did that with all the English speakers in the world. There's English speakers in South Africa, there's English speakers in England and Germany and Australia. It doesn't quite match, but folk tend to do that. So just giving you an idea of some of these different definitions. It's another piece. Race and ethnic identity, an individual's awareness and experience of being a member of a racial or ethnic group. Whether or not we see people as being a part of different ethnic groups, people experience their lives in these ways. If I'm looking for a mental health provider, and I get referrals all the time, and I have to explain to people, I only work with the kids. And then at that, I'm now working at the university. I don't have a big office, but I get referrals because people are looking. In particular, I need a black therapist. I get that piece. I'm just glad they're coming and asking, because we know that there's whole populations, in particular in LA County, African American and Latino males are not likely to access services unless it gets to a critical point. Whether it's suicidal ideation or some other type of severe mental health break. But yet we act as if we just provide generic services to everyone, we'll meet everyone's needs. And it doesn't always work that way. Sometimes we have to think differently about those things, but the people who need the services think sometimes in their own racial and ethnic identified way. Minority access. So we've seen that for all children, high numbers have unmet needs for mental health services. So with the Surgeon General Satcher a few years ago, they did a huge report from the Surgeon General's office on mental health, and they're seeing that many children have unmet mental health needs. So we know that there's many populations. So whenever I get a referral, I want to help folks get to that point where they can access those services. Some of the other issues, though, that have been brought out: language barriers, insurance and poverty issues. In California, insurance, when I first started, you can fill out some paper, send it off to a local medical office, and folks can have access to insurance. Now that's not the case. Or AB 3632. You didn't have to necessarily qualify to have any demonstrated emotional disturbance. You could just be receiving special ed services and demonstrate some level of need, and you can be referred for anything from outpatient to residential services, and that would flow right away. So the funding sources are a huge impact to whether or not people get mental health services. Sometimes because we don't necessarily have a funding source attached to at least our ability to triage a case, we are it for many communities as far as school psychologists or school-based mental health providers. We're it for many communities when it comes to mental health services. Children constitute 40% of the nation's homeless populations. At the high school I worked here in Long Beach for about 10 years, Cabrillo High School, they opened a very large homeless shelter area from older military housing, and they reconstituted it and updated the housing there. But they also had a school for transient families and as well foster youth, in particular gay and lesbian foster youth. And that became just providing services to that group became a full-time job. And it was a good thing that it occurred in regards to being able to put those things together, but I'm thinking, what's happening with everybody else in the city? Because this was only one section of the city. Who gets access to those services, and who's training people to follow through with those types of services? Then there's healthcare in general. We know the debate that's gone on since the current federal administration, in particular President Obama has been in office, and the discussions around healthcare and other issues. I went to a conference on overrepresentation of minorities in special ed, and there were some folk there from Canada. And they said, we don't have any of these problems. In fact, we don't even expel students. We use all the mental health services we can right there at the site, because where are they going to go? They're going to go right there in the same school district, or they're going to utilize the other services. Streamlining this makes things a lot easier. However, we just have different challenges, and I'll give you a couple examples. And I don't want to call out the actual insurance providers, but some providers allow you, if you have an HMO, you're kind of locked into the list. If you have a PPO, you may be able to go and find who you may need to find. And there's some folks who have really good insurance and are able to access who they need, and their children may have a 504 plan, and they're on good meds, and we may not even know about them as a school psychologist unless we check in with the nurse and see the list of kids who are taking meds at school. But then there's another group, and usually sometimes these are our colleagues or classified staff. Or my father, he's had to switch insurance to a particular type of HMO that kind of says, if you're in this area, this is the only hospital that you can go to. I'm not going to call out the hospital's name, but they want you to thrive, I'll say that. And so I've seen families have to be referred there, but they don't have the options to talk about, does this psychologist really understand where our needs are coming from? Although they may have translation services, do they have cross-cultural services? And they may be overinsured, in that if they had Medi-Cal, they'd be able to get a larger range of services or different types of options, maybe even wraparound services. So it's just complicated. I'm not saying it's right or wrong, it just is. And sometimes that complication leads people to just say, I'm not going to bother with accessing this mental health stuff. We're going to do what we can to try to work it out. Either we'll move, we'll go to our local church, we'll try to talk with some friends and family, or I know somebody who had a similar problem, and we'll just try to work with it the best we can. The other piece is cultural competence. And one of the things I've discovered when I teach the cultural competence components of all our courses, every one of our courses at Cal State Long Beach, we have that within there. However, students will respond sometimes with their own essays. And I'm working on a study on this because I know it's going to be statistically significant. that they'll say, you know, I grew up in Southern California, so I didn't really think about these issues. I grew up here too. And there was a period where I thought, well, everybody's the same. Everybody has access. This isn't like my mother growing up in East Texas in a segregated area. However, sometimes folks get overlooked. Or sometimes even they're not even aware of all the range of services that they could have. Some things I found that I've worked with some people whose family are in politics. They're driving cars that cost 3 times my price of my little Honda Civic. I'm just saying, I drive a Honda Civic. I'm a school psychologist with kids as well. But yet they're unaware of their rights as parents, or they're unaware of the range of services. And let me just be real. I mentioned both my parents who were teachers, and I hinted a little bit that I was in and out of the principal's office. I asked my parents as I was putting this study together, did y'all ever consider maybe sending me to a school psychologist? Y'all worked in public school. My dad was a director of special ed. He knew a lot of school psychologists. I was suspended for some pretty significant externalizing behaviors. He said, no, never crossed our minds. He had thought of actually sending me to a speech and language specialist, especially there's this awkward time when, you know, the tween age, and I've always had facial hair. I don't know how that worked out, but I kind of developed a little earlier, so I'm about 10 years old and my voice was cracking. It freaked me out. So I went through a period where I was mumbling, and he was every week like, okay, we're taking you to the speech and language therapist. But I asked him recently, did you ever no, didn't even think about it. So both my parents, master's degrees in educational administration. Okay? Didn't even think about that, didn't even cross their minds. And I've talked to many of my colleagues who I've gone to my doctoral program with, my master's program with, especially who are from different minority backgrounds. Would I consider sending any of my family members to mental health? And that's a whole nother study. But one of those pieces to think about. Cultural competence. I mentioned Antoinette Miranda, who's out at Ohio State. If you get a chance to go to NASP, she'll probably be there, and she's one of my mentors. But she's written a lot of the information on cultural competence, and she really started teaching a course on cultural competence at Ohio State, which students take across the College of Education, partly because she wanted to enhance what was going on with school psychology because the conversation wasn't there by and large. So cultural competence is a set of congruent behaviors, attitudes, and this is the key piece, in policies that came together in a system, and within that system people work efficiently in cross-cultural situations. Now, there's a resource I'm going to give you towards the end, but there's different types of checklists that you can have as an organization or as a school site or as a district that you can go through and say, are we culturally competent or at least addressing some of these particular areas? And that's really where she's going towards. So standards, policies, practices, and attitudes that lead to better outcomes. If we're spending our time on one particular population as opposed to another, we aren't necessarily getting the maximum outcomes that we could. And I'll give an example of this. I worked in, and I've mentioned Long Beach Unified. And Long Beach is a very interesting city in that we've had over 89 different types of languages spoken there, and we always are in the running for one of the most diverse cities in America. And what I like about it is that you may have a housing project nearby, now $1 million homes. They may have kind of stabilized, maybe $700,000 homes, you know, the real estate market. But then all these kids go to the same schools. Now, I had a chance to work over on the west side of Long Beach at Cabrillo High School, which was a newer high school. So I'm not, if you're familiar with any districts where choice occurs, but for those that weren't aware of the choices, they usually ended up at Cabrillo when I first started there. So you had a lot of students who did not do as well academically, whose parents did not have the connected resources to either know about the education fairs. So you have a lot of students there who are struggling academically. At one point, we had a day treatment center, and the school psychologist in charge of the day treatment center, he said, you know, you got 60% of the referrals to our day treatment center out of all the other high schools. And it said some of it was about this access towards mental health pieces. Now, I'd work there 4 days a week, and then 1 day a week, I'd be over across the way at this other school, Rogers Middle School, which is by these $1 million homes or multi-million-dollar homes, okay, over in Belmont Shores area. Okay, there's a gondola ride that goes by Belmont Shores. I don't know if you get this. There's a gondola ride. There's a man who sings. He's a Long Beach, one of them is a Long Beach City College professor. But he enjoys this and he says it pays well because folk around here got money and they like to go on gondola rides. I'm just giving you an idea of Belmont Shores. Okay. They have smaller middle schools. Middle school only had about 600 students. In comparison to the rest of the middle schools, had 2,000 students. Okay. But yet, they got 1 day a week of sight time for me. Okay. What I learned quickly is that in shifting gears, I said, I gotta stop shifting gears. I have to provide the same level of service no matter where I'm at. And if I'm bending over backwards for every advocate that demands something, that's time taken away from me being able to provide high quality mental health services to other folks. I'm not lessening my services for either group. And eventually I learned also, you know, in the areas where there's high poverty, there's also sometimes district attorneys who have requests, judges who write little notes of paper asking for IEPs. It's not different in a low poverty area in regards to the legal demands and other things. But if you're providing it the same across, and I just had to do it as a new psychologist because I couldn't quite figure it out. These folks are coming over here with lawyers and other things, and it was intimidating at first when I realized I know my job better than them in regards to what our students need. I even got a tip from a more senior psychologist. He said, they get 1 hour of your time because you got 2 ED classes over there with kids with high needs. You need to do some mental health services there more than you need to sit in an IEP and lose your own mental health over minor things like who faxed the assessment plan on 5 in the afternoon on a Friday and whether or not it was received within the 15-day timeline. In comparison to a child who's been in and out of the hospital, who's cutting themselves, who hasn't received the mental health services that they need, and I'm busy advocating for them because they don't have an advocate or their family doesn't have the money to pay for a lawyer. So you getting the picture here? All right. Where is it at? I was so into that one, I almost lost my place here. Basic cultural rights. Families have a right to culturally specific services. So there's been lawsuits in regards to appropriate assessments in different languages, but also getting to know the cultural and environmental history. I will say I'm hard pressed to find, in all my years of doing triennial reports, psych reports that would rule in or rule out environmental or linguistic issues, or at least speak to them. It's very rare. Now, I have a really good professor also at San Diego State, Sam Ortiz, who stays in my ear, on my shoulder, like, hey, you have to remember to at least address those particular issues. But also, get to know that family. Get to know the quotes. Get to know what the child's preferred language. That's not a requirement, but it gives you a better idea as to their own acculturation level. It gives you an idea of their family's acculturation level. There's just some of those pieces that are in there that you could even include, whether or not it's a psych report, but even in your just intake information about mental health services. Religion as well. I'll give you a quick example. There was this was, I think, 99, so it was before 2001. But I was working with a Muslim family, and the father had gone to, I think, probably Iraq, I think, at that time. And he'd come back, had some post-traumatic stress disorder, and he was not able to live with the family anymore. And the family had stopped praying. But one of the things I look for in basic patterns is, what are the things that have kept your family together? And I asked them, just doing some solution-focused counseling, they said, so I asked, what was the last thing you had? They said, oh, we used to pray. I mean, and if you're familiar at all with the Muslim culture, you know that's a huge part of life. And they had stopped doing that. both the mother and the daughter were still wearing the hijab, or the head scarf. They were still going to mosque, but they were not praying anymore. So just even asking some basic questions or being aware of their life helped to move the situation forward. Experiences of minorities in regards to African Americans with research have had disastrous results. I know everyone's familiar with the Tuskegee experiments. There's a really interesting book by Harriet Washington called Medical Apartheid, and it chronicles some of the history with African Americans and the medical field as well as the psychiatric field, but another one for psychologists, which I even call it almost an ed psych or school psych book. It's called Even the Rat Was White by Robert Guthrie. Even the Rat Was White. And he passed, I think, in 2004, 2006. But he really chronicles the history of American psychology from the perspective of African Americans. And then also he lists a lot of the first black clinical psychologists started off working in schools, or they stopped their progression towards their PhD and taught for several years because they wanted to apply immediately the things that they were learning. So it's kind of a hidden nugget within that book of school psychologists. I was just excited, like, wow, they're all here. And he has a listing of all these different folk who were some of the first. An example is Kenneth and Mamie Clark, who were the psychologists who did the Dole tests for the Brown versus Board of Education school desegregation case. So some of these are real histories. I mentioned before the history with the pools, from the pools to the schools, but these are also real histories in regards to research and people looking at, well, if you're a psychologist, that means, I don't even know what that means. Okay, my aunt, I love her to death, but she still swears I'm a school counselor, and then I can get people into college. So she calls me at least once a year for one of my cousins that I've got to get into college. Okay. But folks sometimes aren't aware of our role as what school psychologists can do. School psych's role in school-based mental health. So NASP views the role of the school psychologist in providing service to students as a very integral part of the mental health care system for children. And school psychologists are uniquely qualified to provide comprehensive, cost-effective mental health services. This is from the position statement on mental health with NASP. And so for folk who wonder, can I counsel? I gotta be real with you. I did a lot of counseling, but I found I could address more students when I thought like a mental health provider. And I made sure that the mental health needs of the entire school was met. Rather than just, well, let me do a lunch bunch here or there. I started keeping track of who I was delivering the services to. So the question I had in doing this study is, are there other folk who think like this? And can we help make this shift from, man, I don't have enough time, I don't have enough resources, to let me do whatever I need to do, use the best data sets, work smarter, not harder, to provide the services to the students who are out there. Because we know there's a need out there, but they're not making any more time as far as I've seen. At one point, I used to try to work about 60 hours a week, then I realized, this ain't working. I'm gonna burn out before I get to, and I just turned 40 recently, and I did burn out at about 36. Trying to work 60 hours a week, trying to do all these different services, but my kids are always very good at kind of bringing me back. Dad, are we gonna actually see you around? So if I can't even have the mental health services at my own home, and some of my classmates, I'm just trying to keep it real here for y'all if you're thinking about providing these mental health services. I don't know if you're familiar with this walkie-talkie culture in schools where everybody's got to put out a fire immediately. Okay? And a lot of my classmates in my doctoral program were vice principals who were driven by this. And we had some deep talks about how are we going to raise our own kids when we're busy raising other people's kids. So just in thinking about also the mental wellness of our colleagues, teachers, administrators, other school psychologists, those other pieces. So we're there to educate staff. And educating staff doesn't always mean you have to get up front and talk to people. Most of our staff meetings in one of the schools I was at, it was at 7 o'clock in the morning. I'm not a morning person. I'm not getting up at 7 o'clock in the morning. As you can tell, and for those of y'all that were here nights and early, as you can tell, I'm just not a morning person. My daughters had to really, like, Dad, you need to go. I saw you put out your bow tie today. You better be on your stuff. I used to put out a newsletter once a week about some similar issues. How do we make a referral to an SST? Or if I had a group of referrals in particular for several Filipino students, maybe it's time to share some information about just the folks here in Long Beach and some of their views of mental health. Or I did an interview with the local pastor, or I did an interview with a local community member or some parents about their views of the mental health services here. And it would sometimes only be a half sheet of paper. I'm not asking you to suggest and write another psych report, because I know they keep getting longer and longer. I read one, it was like 31 pages. I've seen them. And I know folks, some who keep them down to 5. So, there's definitely a range, but like I said, time is not, they're not producing any more of that. Parents, okay? And there's more and more ways to access parents nowadays. I've seen some folk do a really excellent job of using things like School Loop or the school's website, or videos that parents can have access to, or even having some of those videos translated to make sure that folks are making those connections. Students have always been my best advertisers. I always said, if you got something from this, go get somebody else. My most interesting group were a group of girls who were diabetic, who also had some suicidal thoughts and prior abuse, but they were making some really poor health choices. So I talked to 2 of them, and I put away all my sugary candies, got some sugar-free candies, and they brought back about 3 or 4 more, and we had a group for about 6 weeks just for students with diabetes or other chronic health conditions, and also depression that went along with it. But they made the referrals. I've even had an intern, really wonderful intern, who's been a school psychologist now for several years. I have to keep reminding myself of that. She was an intern at one point. She's outstanding. Vivian Rodriguez. If anybody remembers this show, Teen Summit, from Black Entertainment Television. But they bring in different people. Sometimes they bring in clinical psychologists, other things, and have the teens have the topics, but they would ask them issues from their perspective. So she put together a club, and once a month, the students would put this together, but she'd go get the guest speakers. She'd say, all right, give me an idea of what the topics you want, and I'll go get somebody. Hey, we're interested in relationships. We want a therapist who knows about how to deal with these relationships. We're interested in somebody talking about gay and lesbian issues because people are getting teased or argue with, or we're having relationship problems. We want to know. So they go and get somebody for that. We're going to be likely the first in our families to go to college. What is it like to go to college? We want to hear from somebody who teaches out of university. So she bring these folks in, but they'd also know, oh yeah, that's the Team Summit lady. Yeah, go ahead and talk to her. Best referral sources can be students. Also, I've found that providing information regarding the symptoms of mental health and the resources that may be available is a good sheet of information. Maybe it's just a small sheet of information, but it's good to have ready to go. Not looking for it around any other places, but ready to go when people come in. And sometimes less is more, I've found. But if you have accurate and current information, it helps, especially after a crisis incident. If you have a list of the types of symptoms or red flags to look for, it can help target a lot of your referrals. Providing a continuum of services, or at least making a list of those services. So you may not need to provide any more services other than at the beginning and maybe the middle of the school year, take some time to really refine that list and make sure that families and students can get in contact with those resources and that those resources are viable. Establishing a crisis response team. And I found that some years I would have to stay on the administration to make sure that they supported and knew what our crisis response plan was so they can access that team when the time came.
connected with outside agencies, family, and school personnel to ensure the best services at school and in the community. And, in thinking about these different things, and maybe we just take a couple moments, but I'm curious as to maybe you discuss in groups of two. What are some barriers to keep these types of things from happening in schools today? What are some barriers you think that might keep these things from happening? So in groups of two, take about 2 minutes. So this whole list right here with the school psych role. What might keep some of these things from happening? Establishing a crisis response team, a continuum of services. Go ahead and talk amongst yourself for about 2 minutes. Who would like to go first? Because I can make my grad school students go first, but that's a whole other deal.
We just discussed, time being a huge
Right.
barrier.
Right. Time, and that's one of the things my grad students were discussing. Yes.
At hers, it's the opposite. She has a lot of support, admin and DO support.
Right.
And they have psychs at every single school at all times. We do not, of course. I know, I was like, I'm moving like now.
Yeah.
And we do not. We're spread out, usually 3 schools or more.
Right.
So we need admin support. We have access to some crisis, but it's OCDE. I don't know if anybody from down here, Orange County Department of Ed, and it's too hard to get that. So you're really on the fly doing whatever you can do at the time. You're called from another school and hopefully can get to your school site. Otherwise, it's a 911 call.
Right. So, if I can, maybe kind of combine some of these ideas here. So, if you're lacking time, sometimes it's a matter of providing the data sets to show that if we shifted maybe 1 or 2 of our priorities, and we know of a district that's nearby, or at least within the state, that has shifted their priorities. Right. But it's within the state that has shifted some of their priorities and are able to address some of these different needs. I think one of the other tensions that I don't often talk directly about is the traditional practice versus an RTI model. And I don't know if there has to be that particular level of tension if you're able to show that you have good outcomes. Keeping data is kind of like sharpening the saw, if you're familiar with the 7 habits of highly effective people. And I'll explain that in a little bit, but I want to hear some more comments. I'm going to write down sharpening the saw here. We go ahead towards the back.
I come from a pretty rural county, and we brought attention based on surveys and data, and some administrators will even bluntly say, we don't want that slogan. So when we talk about suicide prevention and starting it in school, or gay and lesbian issues,
Right.
they don't want it to exist.
Right.
And so there's a need there, but you can't override a principal or superintendent in the district
Yeah.
when even the data and surveys when kids are saying that.
Right.
And you're bringing it to, so that's a barrier because when we have resources, it's hard to override. Thank you.
I hear you. I mean, and not too far down the freeway, I was in Long Beach where we had an outstanding gay and lesbian student union. City council folks and public assembly members would come to our day of silence. This is less than a 25-minute ride down the freeway. There's another school district that said, no, we're not having that at all here in the Orange County area. And students came together and had to protest. But one of the things was that they built coalitions together across different schools. And even if they didn't want an outward conversation, they at least shared the resources and helped provide some level of support to those students that there were other folk out there who were pulling for them as well. So, yeah, these are real live barriers. Anyone else?
Budget.
Yes, yeah. I mean, it keeps getting tighter and tighter. CSUs, NPR down here, we hear about the CSUs and what the governor's doing and how we just don't have any money. So in that type of atmosphere, folks start holding on to their budgets or their perceptions of what the budgets may mean out there. I don't know if y'all have heard this latest one, how they approved a pay raise for 2 presidents. yet, you know, millions of dollars, the CSUs are behind. So some of those political types of things as well. Just to say it outright, it's politics. Sometimes it keeps good policies from going forward, or good procedures and good science from going forward. Over here, then, you know, I come back over this way. Any other
Well,
thoughts?
I
Yeah.
said, changes, that when personnel changes, there seems to be, a lack of consistency of what the information is.
Okay.
And so then it makes it difficult to, you know, like the list, you were saying, you know, at the beginning, in the middle, to update the list, to have that ready to go.
Yeah.
Well, I got assigned to a new campus this year, and I
Right.
couldn't get a straight answer about anything for a long time. Nobody knew what the answer was, cause there had been change, or when somebody asked me for something and I shared my understanding of how something might happen, like an SST process versus just testing because a parent asked for it,
Yeah.
getting the response, well, that's not the way it was done the last 5 years. When did that change?
Right.
Well, it didn't actually change, it's been
Right.
that way, that just might not have been the way it was carried out.
Right.
And all of that sort of stuff that happens.
Right. And some of it is about a perception as well of what's good practice versus really poor practice. And then folk have a hard time realizing that, ooh, yeah, if we actually took time to evaluate what we were doing, we're not necessarily getting any better at providing the services or providing a good policy that would actually help students in the way that we want to. Although we may have a good meeting. I've been in SSTs like that. We have a good time. There's bagels and other good food, juice. We have a good time at the SST, but it didn't necessarily lead to some, if we looked at the numbers for the students, it didn't necessarily lead to some better results. Yeah. Over here, or any other comments?
I was just going to link on to sometimes just the sustainability issues and not having systems in place. You know, I'm from Oregon, and one thing that we're really trying to do at the state level is work with our partners, Healthy Kids Learn Better, Oregon State Schools and communities, to really start with what is the Center for Disease Control Coordinated School Health Model. So to start out with parents and administrators and health teachers, PE teachers, psych services. So we build our PBIS systems on top of that. So we already have these partners. And it is just a way that we found that really overcomes some of these barriers,
Mm-hmm.
having the systems in place, having the connections in place
Right.
before we move forward.
Yeah. So, anyone else have any thoughts on it? Okay, sharpening the saw. Okay. Story 2 loggers. They're chopping down trees, and they're having a race. It's an all-day race to see who can chop down the most trees. The first logger, he's going at it, and they get to about noon, and he's getting a little tired, but he says, I'm going to keep going. Because the second logger, he stops. He says, forget about it. I'm taking lunch. I'm going to eat. I brought a bag. I brought a thermos. I have a little coffee. Cold out here. And he just sits down. So the first logger's like, yes, I got it. What is he doing? And he just keeps going. It's about 3 o'clock. I don't know if anybody's ever experienced this, but you've been at a school site and you had the IEP. You thought you were going to get a chance to get that lunch, and then a kid comes in and they're crying. It just happens. And then by 3 o'clock, though, you are wiped. Just done. Well, this first logger, he's done. He's slowed down. He can barely move that saw. Second logger, he's still going. And he beats him maybe by 10 logs. Well, the story is you got to take time to sharpen the saw. If not, you will burn out very quickly, or your services will get kind of ground down into, as you were talking about, well, that's just the way we've kind of always done it. But that does not mean that it's going to be good for you or you as a team. Similarly, if I can use some of the wooded or shift to another metaphor, you got to weed gardens from time to time. Mess gets in there. That's just the nature of working with organisms. In particular, if you're working with human beings around significant mental health issues, sometimes folks do things out of convenience, but also out of, man, I just got to do something now. But that becomes a policy or this is the way it is. I'll give you one other example. I've worked with about 7 different school administrators at the high school I was at. But every time we had a manifestation determination IEP, it was as if it was brand new to them. All over. They may have been at the same school for 10 years. But now this new IEP, what do you mean? This kid's in special ed? We have to have a whole IEP? You have to do a behavior plan and a report? What? Remember we did this about 3 months ago? Oh yeah, that's right. That's right. But when folk are in those moments where the administrator said, "You're out of here, I can't," and hollers at this kid, sometimes that becomes standard practice. Especially if I'm a new administrator looking at the senior administrator who's maybe having a bad day or a bad week or a bad year. Out of 30 years, you get one bad year, but that's the one you see and that's the practice you develop. So you got to take time to sharpen the saw. And if you do that, you may find that you don't need to start with all these different things, but maybe you start with one that year or that semester, and you add on another piece, then you add on another piece. But there's definitely barriers out there, and it's worth it to think through some of those things strategically. Another piece I would do every year, I'd meet with the administrator in charge of either special education or support services at our school site, or I'd meet with the principal directly if they would be so willing to spare the time. And sometimes I just have to kind of stalk them and do a progress monitoring behavioral sheet and see how much time they actually paid attention. I had one administrator who paid attention for exactly 7 minutes, and then he was going to talk you to death and move you out his door. But I said, I know you. Give me the 7-minute pitch. Now I'll tell you why we need more mental health services here on campus and why I can't provide all of them. I can only see, my intern and I can only see about 40 students consistently a year when it comes to really good mental health services, but the need is much higher. And I have the numbers to show it. But it was a 7-minute pitch. Okay, but you gotta plan through some of those things. All right. Okay, so school counselors and school-based mental health providers. Now, if you've been in California and seen some of the changes with the A through G requirements, and you've seen some of what the school counselors are going through to have to make sure that the high school exit exam is taken care of, that some of the other issues are taken care of, it's a challenge. So, but Tucker also states that referring, this is coming from the American Counselor Association, referring students for mental health care is a core job function of school counselors. So, and also the American School Counselors Association, the school counselors ensure that students are supported and safe within the school community. Now this is one of the standards, so I'm thinking about the conversation you're having with some of your administrators back there who don't want to bring some of these issues to the fore. If you we've got to do that. That's a part of the NAS standards. That's also part of our job descriptions to ensure that students have access to high quality mental health services. That's even in ENCO. In regards to if a student has on their IEP, formerly known as CASP, now related services, whether it's counseling, psychiatric service, or psychological services or behavioral consultation, we have to follow through and make sure those things occur. So how we do that makes us invaluable, as long as we're doing it. But if we're saying, not me, there's going to be a concern. The other thing my dad used to always tell me, as a longtime school administrator, his favorite thing was, wow, this is an exciting opportunity. So, of the things that I'm doing, what do you want me to take off? Now, I may volunteer 2 or 3 things already that I need to let go of in order for this greater priority. So I knew that if I shifted to a more mental health model, I'm probably going to be able to impact the lives of about 200 students as opposed to 20 that I was really working well with. And so, like I said, I wasn't able to do my counseling, which I love to do, but I wasn't able to do it as much anymore. But I kept track of 200 students and ensured that they all were seen within 4 days. Okay, now I'll talk a little bit more about how I did that. Good to see you, friend. We had a chance to do a presentation together a few years ago, so it's good to see you, Gina.
Have you experienced many school districts that employ MFTs directly to supply the school-based mental health services to the students as opposed to a school psychologist?
The experience I had with that was when Healthy Start funding was available, or other types of Title I funding. I've been petitioned when I went to the principal with my 7-minute pitch. It was about getting $10,000 to pay for a PsyD intern. So I've seen it happen, but they're not necessarily directly employed. I've seen them as either contractors or consultants with the district.
In our district, we have 10,
Mm,
an equal number of psychologists
wow.
that do that, but it's kind of pushed us out.
Yeah.
And now we don't even deal directly with ED or alternative placement.
That's a shame.
So just trying to advocate for ourselves because we know that that's not the nature, but you have this administration.
Right. Well, some of it may be, you know, this is some of my little theory that every administrator knows one school psychologist that they really liked. That could have been 20 years ago, that could have been last year, but that one. And that's how they perceive all of us. The challenge is being able to, as a group, being able to share the range of services that we can provide and somewhat getting our message. I don't know about y'all, but I got family members who think I'm a school counselor. So being able to explain what it is we do in a broad sense helps with jobs, because I've seen it happen. I've seen it in other places where, and I'm not putting good or bad on it, I'm just saying this is the function of what's happening. ABA providers, due to the lawsuits, applied behavioral analysis providers have been hired instead of school psychologists and taken their jobs because they felt that BICM training wasn't enough. We need some other training that's, and one last pitch and I'll leave it alone because if I stay on it too long it's going to get crazy. That's not approved by the state of California. However, ABA, applied behavioral analysis, however, they can do a good job if they provide the outcomes, but it's not approved by the state. But yet we're fully credentialed by the state. We're usually already on staff, but in some school districts have decided to train their school psychs or make sure that they're trained because they see the benefits long term. Sometimes you have to put that money analysis forward for them so they start seeing the benefits long term. But every once in a while somebody has some political situation and they get some money to have the MFTs on staff and it works out better for them with their outcomes. So a lot of it's political. In school psychs, we're not always as willing to do that political piece. Go speak in front of the school board, get to know the school board member who's about to make that vote or who knows another school psych or who knows a lot of MFTs. I've seen some interesting things on YouTube about school board members, what they do know and what they don't know about what school psychologists can do. And we have to be advocates for the services that we provide because we're going to provide services to a lot of students. So, if you don't mind, I'm going to skip past some of these pieces here, but I'm just going to, we're all familiar with primary interventions, secondary and tertiary interventions. To do that, I think it's good to at least have a plan for how students go from one to the other and make that clear, at least to the people who refer to you the most. If you know that it's teachers or if you know that it's your colleagues who are the other school counselors, at least for me that was the case. I would let the school counselors be my primary source for referrals and the administrators. Sometimes I'd have to fuss at the administrators a little bit because they wanted to provide discipline or punishment, as it were, before we provided some other types of service. Critical race theory is another piece that undergirds some of this to explain some of the reasons why not everyone has the same level of access to services. And it's similar to the critical race theory of legal scholarship. I'm sure some of y'all have heard this in the news. Professor Derek Bell, first African-American professor over at Harvard, came up with some of the ideas for legal scholarship, but Ladson, Billings, and Tate really talked about it in regards to education, so they have some ideas here. Race continues to be significant in the United States. I would even apply that to your school district. If there's groups of students who are not receiving the services that they need, and you look at the numbers and it's disproportionate, that's race continuing to be significant, at least in your district. U.S. society is based on property rights rather than human rights. Property rights is a very different concept. And there are some folks who still culturally struggle with this piece. That you have a piece of paper that says my kid is what? My first year as a school psychologist, I had a parent say, you know, this is all well and good. I know my kids had an IEP for a long time, but you're not going to put mentally retarded on any psych report or anything that we have, and you're coming to our house this weekend. We're going to cook you dinner, and you're going to see exactly what my kid can do. So here I am. I've gone to this culturally competent school psychology program, San Diego State. We're serious. Shed tears at San Diego State over the seriousness of our cultural competence, but this family taught me more in an evening than I'd learned in all 3 years at San Diego State about what it meant to see a child fully. So this idea of having just a sheet of paper to explain something really doesn't quite get it, especially for families who are working cross-culturally or who really aren't as into this IEP as I am, talking all this legalese. And I'm even talking middle-class families who have college-level degrees who, IEP, AB 36, 32, Final Four, what are you talking about? We were trying to develop goals. I was an advocate, and I'm a pro bono advocate. I don't see any reason to charge people for being an advocate. That's just me. I know other folk may do that, but that's just me. And I was at the meeting, and the father is a police officer, and the mother is a nurse, and she looked at me and she said, and she's sitting right next to the special ed teacher. She said, what is she saying? I have no idea what she's saying. I work in a hospital with medical doctors. I have no idea what she's saying. So this idea of property rights versus human rights. The intersection of race and property creates an analytical tool for understanding inequity. And this last piece, whiteness beyond skin, but culture, attitude, and actions on behalf as if one type of property. Now, I gotta be real with you. I have access to this certain type of property, okay? I could shift my voice in different ways. My mother, when people would call, I could tell when she was talking about property issues or in particular bills on the phone, or if she was talking with family. She's from Texas and her accent completely shifts, but she has access to be able to code switch, as it were. If I have a diploma, I have rights and privileges thereunto. Every diploma says it, or every degree says it. I have access to a certain level of property. So this is some of where they're talking about. All right. So getting into the study here, and this number here is in regards to the number of responses given, but grad students interviewed over 60, but we were able to only keep 30 of those interviews. The other 20 did not collect all the demographic information I needed, and one school-based mental health provider was interviewed 2 times because he was so good. School-based mental health providers, 36 school psychologists, 1 school counselor, and 2 therapists were interviewed. LA and Orange County schools were 25 out of 39 schools had over 51% Latino students. 7 schools were multicultural with no ethnicity, over 45%. 4 schools were mostly Asian Pacific Islander, and only 3 were majority white with over 60%. As far as the school psychologists themselves, or the school-based mental health providers themselves, 3 indicated they were Asian, 13 Latino, 14 white, and 12 not indicated. API scores, or the Academic Performance Index from the schools, range from 619 to 920, and 772 is the average. In California, 800 is a solid score there, or a good score for a school. Many respondents at more than 1 school site, so we had high school, we had middle school, we had elementary, K through 8th grade, and 2 did not indicate exactly where they were at, and some of it I think because they had multiple sites that they didn't even have time to think about one site versus another. They just answered the questions. So, in regards to the access for minorities, and I prefaced some of this question in regards to the issues in LA and Orange County for, the follow-up question was about Latino and African Americans' access to mental health services in particular. And the majority of respondents gave a short answer and some gave no answer only. So some of the issues though that they indicated were stigma, insurance issues, and translation services were the top 3 hindrances to minority access.